Swadika, good morning and welcome to the morning edition of NBT World Brief. I'm Shanita Sidagit Krethon. Our first story today, Prime Minister Anutin Chanvirakul has made his third visit to flood-hit Songkhla, directing emergency operations on the ground. Prime Minister Anutin Chanvirakul returned to Hat Yai, Songkhla to closely monitor the situation and deliver essential supplies for a third executive day. Upon arrival, the Prime Minister shared an online briefing from the military and ministers. Anutin said that he's deeply concerned for residents who have endured more than 5 days of severe flooding. He reaffirmed that the government is doing everything possible and will call an urgent meeting in Bangkok to expand relief and recovery measures, noting that the damage is significant. He later visited flood areas near the irrigation canal bridge in Ban Bang Phep Patana in Hat Yai district, where water levels remained high. Despite the rain, he met residents, offered encouragement and distributed food and essential supplies. The Prime Minister reassured the public that the Floods Crisis Operations Center under the emergency decree is fully supported and fully authorized by the government. Flood Response Center says conditions in the south are expected to improve within days as authorities move to evacuate vulnerable residents and shut down widespread misinformation. The government's Emergency Flood Crisis Operations Center says flooding across southern Thailand should ease significantly within 5 days as rainfall continues to decrease. Officials, however, warn that several provinces are still facing expanding flood zones, with evacuation orders already issued in parts of Satun and Nakhon Si Thammarat. Government spokesperson Siripong Angkhatsakul said that there are around 40,000 cases submitted the request for assistance through official channels. This information is relayed to frontline workers every hour. The frontline workers will conclude each day of work at 7 p.m. The spokesperson noted that some residents remain reluctant to evacuate, raising concerns for those considered vulnerable groups. Provincial governors have been instructed to locate and persuade at-risk individuals to move immediately to designated shelters where support will be provided ahead of any worsening conditions. The Ministry of Public Health confirms that the official flood-related death toll stands at 33 across 7 southern provinces, 9 reported in Nakhon Si Thammarat, 4 in Pathalung, 6 in Songkhla, 2 in Trang, 2 in Satun, 5 in Pattani and 5 in YALA. Most fatalities resulted from drowning, landslides, electrocution or being swept away by strong currents. The government also denied rumors of a helicopter crash, urging the public to verify information before sharing. Medical authorities are racing against time to evacuate critical patients from Hat Yai Hospital as flood waters continue to rise. The Public Health Ministry is closely coordinating with several agencies to evacuate patients from Hat Yai Hospital in Songkhla Province as the facilities remain surrounded by floodwaters, with levels inside reaching up to 2 meters and 3 meters at the front. The emergency plan prioritizes around 50 critical patients on ventilators in the ICU, followed by approximately 600 inpatients. Helicopters are being used as the primary mode of evacuation, supported by 3 aircraft with plans to add more. Additional helicopters are also transporting essential supplies, including food and medical equipment. Since Monday, almost 90 critical patients have already been airlifted to Songkhla and Prince of Songkhla University hospitals. Meanwhile, around 400 to 500 less critical patients will be moved once floodwaters recede and large trucks can access the area. area. Hospital Director Dr. Wirod Yommuang said that the staff are exhausted after 5 days without proper rest. To support them, mental health teams have been deployed along medical teams from surrounding hospitals. Emergency generators and oxygen supplies have now been secured, and food deliveries now provide up to 2,400 meals per day for patients, staff and relatives stranded in the hospital. Dr. Wirod confirmed that the 14 deaths during the floods were among palliative care and elderly patients in ICU and were consistent with expected mortality under normal circumstances. The Health Ministry continues to monitor the situation closely, ensuring all resources are in place to protect patients and staff. Flood conditions in YALA are showing early signs of improvement, but several southern provinces, including Narathiwat, Satun, and Nakhon Si Thammarat, continue to face severe impacts from days of continuous rain. In YALA, floodwaters in several parts of the municipality have begun to recede despite continuous rainfall. Water levels around the YALA railway station and nearby commercial areas are dropping as municipal teams work to drain water into the Pattani River. However, some low-lying communities remain inundated. Schools in the municipality will stay closed until next Monday as authorities monitor conditions. YALA enters its second week of flooding affecting 8 districts. More than 45,600 households covering over 122,000 people have been impacted. In Narathiwat, the situation is far more severe. 4 days of heavy rain have produced over 1,400 millimeters of accumulated rainfall, flooding 11 out of 13 districts. More than 80,000 households have been affected and 4 deaths have been reported. Satun province is also struggling with widespread flooding. Authorities said that the hardest hit area are Langu and Manang districts, which are receiving runoffs from Songkhla, Pathalung and parts of Trang. Internet service and transportation remain disrupted, and small vehicles are advised to avoid interprovincial routes still under high water. Local authorities have opened 42 temporary shelters across 6 districts, now housing around 2,700 displaced residents, most of them in Mueang district. In Nakhon Si Thammarat, Promkiri district has endured flash floods and overflowing waterways since November 17th, affecting over 9,000 households. 2 evacuation centers remain open as authorities continue damage assessments. And that wraps up our morning edition of NBT World Brief. Stay updated with the latest development right here on NBT and NBT World. For more stories, simply scan our QR code on your screen to access all of our coverage across all social media platforms. Until next time, I'm Shanita Sidakit Krathon. Sawasdee ka.